Hello everybody, welcome to my channel. Today I am going to present all of you about hypoglycemia. Before I am going to show it, I would like to introduce you about two scientists who co-discovered an early development of insulin digital collection. After the lecture, you will understand clinical feature, diagnosis, symptomatic treatment, etiological treatment. Definition about hypoglycemia. Hypoglycemia is an abnormally low concentration of blood glucose. Severe hypoglycemia can be fatal or lead to irreversible neurological damage. Blood glucose level should be measured whenever possible in the patient presenting symptoms of hypoglycemia. If hypoglycemia is suspected, but blood glucose measurement is not available, glucose or another available sugar should be given empirically. Always consider hypoglycemia in the patients presenting impaired consciousness, lethargy, coma, or seizure. This is about the clinical feature. Clinical feature of hypoglycemia: rapid onset of non-specific signs. Mild to severe depend on the degree of hypoglycemia. The symptoms of hypoglycemia have sensation of hunger and fatigue, tremor, tachycardia, pallor, sweat, anxiety, blurred vision, difficulty to speaking, confusion, lethargy, and coma. Now we are going to talk about diagnosis. Diagnosis of hypoglycemia. We can diagnose hypoglycemia by capillary blood glucose concentration reagent strict test. For the non-diabetic patient, hypoglycemia under the 3.3 millimole letter or under the 60 mg per deciliter. For the severe hypoglycemia, under the 2.2 millimole per liter or under the 40 mg per liter. For the diabetic patient on home treatment, hypoglycemia under the 3.9 millimole per liter or under the 70 mg per deciliter. If the glucose measurement is not available, diagnosis is confirmed when symptoms resolve after the administration of sugar or glucose. Now we are going to talk about the treatment. The treatment: symptomatic treatment, etiological treatment. Symptomatic treatment for the patient who are consciousness patient. For children, a teaspoon of powdered sugar in a few milliliters of water or 50 milliliters of fruit juice, methanol or therapeutic milk, or 10 milliliters per kilo of 10% glucose by oral route or nasogastric tube. For adults, 15 to 20 grams of sugar or sugar water, fruit juice, soda. Symptoms improve approximately 15 minutes after taking sugar by oral route. For patients with impaired consciousness or prolonged confusion. For children, 5 milliliters per kilo of 10% glucose by slow intravenous 2 to 3 minutes. For the adult, 1 milliliter per kilo of 50% glucose by slow intravenous 3 to 5 minutes. Neurological symptoms improve a few minutes after the injection. Check blood glucose after 15 minutes. If it's still low, re-administer glucose by intravenous route or sugar by oral route according to the patient's clinical condition. If there is no clinical improvement, differential diagnosis should be considered. For example, serious infection, severe malaria, meningitis, epilepsy. In all cases, after stabilization, give a meal or snack rich in complex carbohydrate and monitor the patient for a few hours. Aetiological treatment. Another than diabetes. To the severe malnutrition, neonatal sepsis, severe malaria, acute alcohol intoxication. In prolonged fast, adverse effect drug. In the diabetic patient, avoid missing meals, increase intake of carbohydrate if necessary, adjust dosage of insulin according to the blood glucose level and physical activity. Thank you for watching. Please subscribe to get more medical videos to make you easy for your studying. Thank you.